Welcome, Dr. Zoe Hodson from the Newsom Health Clinic.
Thank you. It's lovely to be here. How are you doing?
Zoe, tell us about what is going on at the Newsom Health Clinic in Manchester.
Well, it's been a strange start, not the one we quite had planned, but I think as lots of other people are, we're just adapting. And so it's a branch of Newson Health and Wellbeing, which is run by Louise Newson down in Stratford, who is also known as the menopause doctor on social media, which I'm sure many women will have come across because her advice is brilliant. So we have been working together to set up a branch up in Manchester. And so what we're doing at the moment is we're doing consultations. We're still seeing menopausal women and navigating through and helping them quite often find the right HRT for them. And we're doing it via video and telephone consultation at the moment. So it's still very much going ahead, as I say, not quite as planned. And then once we're through this situation, the sort of face-to-face clinic will go ahead and just be a lovely wellbeing centre.
So what have you, because of this moment in time that we're in, so just to clarify, we are at the moment in COVID-19 lockdown. Yeah. Has this thrown up any additional challenges maybe for women who are maybe at the start of their treatment, during their treatment? Have you seen anything particular that's affected women?
I think I think menopause itself is unfortunately still associated with a lot of guilt. Lots of things sort of are starting to take time for themselves, starting to actually look at themselves, starting to prioritize themselves. And I think that's made it even more difficult with this going on, that they feel that they can't approach their GP, they can't ask about their HRT, they can't even venture into this journey to say that they're struggling, because I think there's so much on the media about sort of people in hospital and everything else. And I just think, yes, it's added an extra layer of, and I think I've heard that some women have unfortunately been told by their GPs, well, we'll deal with this when COVID is over. And that shouldn't be the case. We know that the menopause can trigger awful anxiety.
Yeah.
And my heart goes out to these women in this time, because I think it is very easy to manage and can be done over the telephone.
Yeah, because one of the things that I know that you really recommend is the green climacteric score. Did I say that right?
The green climacteric score is it's online, and then there's a lady called Diane Danzebrink, and she has a website called menopausesupport.co.uk. So either or, so the menopause doctor website, if you put symptom list in there, it will come up with a symptom checker.
Yeah.
And I think I see so many looks of surprise when I hand this out to doctors, to women, to anyone in the street, if we can, when we're not social distancing, because I think there are so many symptoms that people aren't aware of. So things like joint pains, anxiety, palpitations, problems with your skin, problems with your sleep. There are estrogen receptors everywhere, and I think we have to change this. It's not just hot flushes. The hot flushes most women can cope with. It's the mood and the feeling disconnected and the anxiety that are the ones that bring women to the clinic.
And so if in this time of social distancing and you women are experiencing or are concerned that they may be perimenopausal, or they're experiencing symptoms that could be a little bit like, could be passed off maybe as anxiety around COVID-19, first of all, we'd recommend them to take the green climacteric. I can't say that word, Dr.
Climacteric.
And then, how would you recommend the language? What language would you recommend they use to approach their GP to get consultation over the telephone?
So I think we know that unfortunately education for GPs is still really poor with the menopause. So it puts them on the bit of a back seat, and it may be a subject that they're not familiar with. If women are well read and know exactly what's going on, it makes things so much easier. And I think just acknowledging, so saying to the GP, I understand that many GPs don't have much training in this, but I've been onto the Menopause Doctor website. I've listened. Liz Earle has done a brilliant guide called The Guide About The Truth About HRT. So I have filled in a symptom checker, and I really believe that my symptoms are menopausal, and I'm aware that there is a very slight link with breast cancer, but I know that, for example, alcohol has a higher risk, and I would really like to try some HRT. The other thing as well is, and we tend to use the transdermal HRT, and that would be either the gels or the patches. And again, particularly when we're doing telephone consultations, we know that those preparations don't have any thrombotic risk. So again, they can be initiated with a telephone consultation. And I think you've got time now. Lots of women have got a little bit more time. Go onto the websites, prepare. There is a prescribing guide that you can download from the Menopause Doctor website if you just type in easy. And then the other thing, so I would often recommend going with the estrogen gel, estrogel and utrogestin. So you can actually see what the GP should be prescribing, and then contact the pharmacy, check that they can order it in. And then I think you've done half the groundwork for the GP, and it just allows them to relax into the consultation.
Yeah, and equally, if people are maybe not comfortable having this conversation with their GP still, that's what Newsom Health Clinic is there for, isn't it?
Well, we're a private clinic because it's actually quite difficult the NHS is not funding menopause care a great deal at the moment. There's lots of pressure to try and change this and different training programs. But so there are NHS menopause clinics, and women can self-refer. But Newson Health is a private clinic. But yes, we have appointments available. The bases are Stratford and Manchester, but obviously we're doing video consultations at the moment. And lots of women have said that they're really pleased with this because it means that they don't have to travel. So it's easier for lots of women.
Yeah, and I think the fact is that we've all experienced now what it is like to have conversations this way over these kind of Zooms. And I think for me, I think it's really important to emphasize that the authenticity and the connection is still there. I mean, we've had great conversations, over the phone, and I think one of the things that I want to really emphasize is that if you have a GP or a doctor that is really tuned into women's health, as you are, that the empathy is so different than you may get from somebody who is not quite on board with it and maybe have their own, their own fear around getting it wrong.
Yeah. And I think that's I think it's such a shame because it is an area where lots of GPs aren't comfortable.
Yeah.
They just haven't had the training. And I think it is that, as I say, within a half-hour conversation, it is very easy to sort of say, well, those symptoms are due to estrogen deficiency. I think those symptoms are due to testosterone deficiency. And it is that thing that I think women tend to feel safe because you know what you're doing and not having to scrabble through a book to try and find the right thing to prescribe. It's just knowing how the hormones work and knowing what the presentations are. And that's probably the bit that makes the difference. So there are obviously GPs around with an expertise in women's health, and I think women will know when they come across those. What we need to do is make this much more standardized, that it isn't potluck who you end up seeing.
And let's talk about for a second evidence-based information around the menopause and HRT. Zoe, what are your thoughts on that?
I think, the media really hasn't been. There's been a little bit of a change in the last few months. I have seen some balanced articles, but they really, really haven't been fair to women going through the menopause. So all of the things around the breast cancer risks, the statistics that they use are just inflammatory statistics. So they will say things like double your risk, when in reality, the risk instead of 1 in 1,000 is 2 in 1,000, which is still double your risk. So that grabs the headlines, but the numbers are absolutely tiny. And again, when you dig down, they're using very old data, so the numbers are tinier still.
Yeah.
This is why I would tend to, I will always point women in the direction of the Menopause Doctor website, because there's, even for GPs, there are all the evidence-based papers are on there as well, and everything is written, and I know that it is all based on sort of evidence-based information, which I think is really important, because women feel really vulnerable during this time, and they have to know that this is true information that they're getting. And I think this is why we've finally got this resource now that we can signpost women to, and they're not just searching and finding random newspaper articles and papers that weren't validated.
Yeah. And I think one of the interesting things that I didn't know is that raised blood pressure is not a contraindication of taking HRT.
I know, and this is, I see, I did an audit of women who'd had a hysterectomy in the practice, and this was so the practice that I was working at had been open for 50 years, so it's quite old data. And I just saw time and time again that I think a lot of the time women are turned away because the GP isn't comfortable per se with HRT, and will cling on to any reason not to go down that route. Mm-hmm. The other reason as well is you assume, or can assume, that the guidelines are the same for oral preparations as they are for transdermal. So this is an absolute fundamental thing, that the oral preparations, yes, have a link with, you wouldn't give them with somebody with raised blood pressure because you're worried about the risk of clot. Whereas, although it's important to manage the blood pressure, the transdermal doesn't have a risk of clot. So you can do both. You can manage the blood pressure, and very often, because the transdermal estrogen will open up the blood vessels, it works on various transmitters, it will probably, and also reduces stress and cortisol, which is another important factor in blood pressure, and it will probably help bring the blood pressure down alongside. So again, if women are needing repeats of their HRT, the transdermal one, they don't necessarily need their blood pressure checking. If they haven't had a problem with blood pressure before, there's no reason why that should mean that they stop their HRT. And we know that suddenly stopping HRT puts you at higher risk. So there's again another lot of confusion out there.
Yeah, because I think as well, if some people are getting repeat prescriptions, because, quite rightly, some GPs, because they don't have the knowledge base that you guys do, that, they've had this fear factor and they're terrified of getting it wrong. And then I know we've been hearing of stories where people are like, well, you can't have a repeat prescription unless you have your blood pressure taken. Oh, but we're not seeing patients right now.
Yeah.
Where do we go? What do we do? And I think it's arming yourself with that knowledge to be able to advocate for yourself and have your own agency.
Yeah. And I think, the other thing as well, just on the side of blood pressure, it's very easy to purchase and this is the word that I can never say, the sphygmomanometer, the blood pressure machine.
I'm glad we've all got words we can't say.
I know, that thing, the cuff. You can purchase one of those online, and I would recommend for anyone with blood pressure, it's much better to be monitoring it at home. You get a much more sort of realistic view. But transdermal is not, it should still be allowed on repeat prescription. As I say, you don't have to keep monitoring the blood pressure to get hold of it.
Good. So in this moment in time where GPs are quite rightly just doing telephone consults, it shouldn't really be a reason as to why we can't get prescriptions refilled.
No.
Yeah. So can we just talk about, before we start thinking about some nice about the neurotransmitters, can we just talk for a second about maybe younger women, the younger women that you maybe see, Zoe, that need some HRT support and may not be aware of it till they get to the point where they come and see you guys?
I think, Louise actually did a brilliant Instagram live for an hour on Sunday, which is still available on her website. And that
Sunday would have been the, what day?
12th.
Yeah, 12th. The 12th of April, just because of 12th of April 2020, for everybody who may be watching this way in the future.
So so it's called Premature Ovarian Insufficiency, and again, there's lots of information on her website. And as I said, she did a whole hour and with women were asking questions. So she was speaking, and that's still available up on the website at the moment to link into. Now, I think that's a tricky one. So between 40 and 45, I would say, again, we wouldn't necessarily use the FSH blood test. Over 45, you don't need one.
Just pause there for a second. Just give us a few details what the FSH blood test.
Now, so this is the blood test that women often the GPs will sort of say you have to have a blood test to confirm that you're perimenopausal. And we know that I think it's £9.6 million a year is wasted on checking this test in women over 45. So the NICE guidelines are quite clear that you don't need a blood test, this particular blood test, over the age of 45. You go on the symptoms.
Yeah.
And between 40 and 45, again, if you're ticking a lot of symptoms on that symptom checker and your periods are a little bit different, then we would often do something called a trial of treatment. And I think this is really important as well, that when you're deciding about HRT, it doesn't mean that you are stuck with it. If you don't like it, it doesn't do anything, it can be changed or stopped. It doesn't mean, it's not an all or nothing decision. And I think this is again, when I was in general practice, I could see the sort of cogs whirring on, oh my goodness, I have to make this decision, I have to make this decision. Well, it's only a system for a day. And this is why you keep, with the gel, you apply it every day because it's in for such a short time. You're not stockpiling it, you're not chained to this. And this is why very often, because especially with the estrogen, it can work quickly, especially for things like anxiety. And many women will know within a couple of weeks whether this is the right thing for them. And what you'll tend to find in that little group, the 40 to 45, with these clusters of symptoms, they're generally right that it is hormonal. And they will say, I know I'm not depressed, this is different. It's not the same. I've had anxiety before, I've had depression, and this is different. If women are under 40, then we will tend to do this FSH blood test, because I think it's important for reasons of sort of things like fertility and lots of other things. And we have to make sure that we get the treatment right, because there's a different risk for things like cardiovascular disease and osteoporosis and even dementia. So the younger women, it is important, but I would say from 40 onwards, really, we should be starting to look at symptoms. 45 do not need this test doing.
Yeah. Yeah. And I think that's really important, isn't it? Because we've got there's so much going on at the minute that's altering our state of moods. So you might have come into this gut feeling a bit, I want to use the word wonky, because I think that's what a lot of women talk about, don't they? Like, I don't associate with these wonky feelings to the woman that I used to be before. These are like new thoughts, feelings, and emotions. So we've now come into this very strange time in our world. And these have then, for some people, these wonky feelings or symptoms have heightened. And it's like, that's why one of the things that we were like, let's make sure that we include this in this sort of season of vlogs, or whatever we want to call them. So, because I think what we've seen is that some women who thought something was going on, these are now heightened, and it's going, hey, look, just come and have a conversation. Because there are these symptom checker that we can walk you through, and then we can help you see that you're not, in fact, going mad. This is very real for you. And what has happened is we've come to this strange time, which has then heightened even more. So let's get you the help that you need.
This is the thing. And I think it's that thing of saying to the GP, could I just have a trial of treatment?
Yes, I like that, trial of treatment. That's great. Yeah.
And I think that takes the pressure away, the fear away from the GP as well. It's that thing of, I'm not making this lifetime decision. It's I have these symptoms, I think they're hormonal, and I would really like to try this to see if they are.
Brilliant. So while we're in that thread, so we've got trial of treatment going on. Let's talk about some other things that we can be doing to support ourselves in this moment of time, because you've got lots of insight into the neurotransmitters. Let's talk about that for a moment.
I think this is when you start to read into it, because all of the hormones sort of feed back, and the pathways are so complex, and you start to realize that how much they support each other without us even realizing.
Yeah.
and then it goes a little bit out of sync, and everything can come a cropper. So you're supporting, and we know that estrogen supports a lot of these pathways. We know that progesterone supports something called GABA, which is a calming neurotransmitter. And then obviously some women will need the testosterone as well. But for the anxiety, we know that things like cortisol are affected by estrogen, things like oxytocin, serotonin, and dopamine. And all of these are to do with mood. So again, what you can do, we also know that women become more intolerant to carbohydrates during the perimenopause, tend to need more protein, can often need to concentrate on hydration because their sense of thirst may be diminished by the hormones going a little bit to pot.
So interesting.
I know, it's everything. Alcohol, unfortunately, is really not great to all of this because your system gets quite stressed. And then what many women will find is that alcohol will have far more of an effect on them. And I know it's tempting in these times to the reward thing again. With alcohol, it's tempting just to have that glass every night. But what you'll tend to find is it will have a worsening effect on things like your sleep and your anxiety and everything else.
Yeah.
So I think if we look, there's lots and lots of evidence for yoga to calm down the neurotransmitters and really help with all of this. And there's a lady who lives across the road from me she's Rest Revolution Sammy
in Manchester, yeah.
Manchester, and she's doing Zoom yoga classes. We know that if your dopamine is running a bit low, you need the Wizzy exercise to just up it a little bit. And there's another group called Shape Your Change for more of the the aerobic exercise. We know that even there's a lady called Becky Quick, who's menopause psychologist on social media.
Yes, we love Becky.
She has some really helpful tips for sitting with anxiety and almost listening to what it's trying to tell you. So my view is that HRT is the springboard. It is the bit that can get you to a level of functioning again, and then you can start to fine-tune things.
Yeah.
So then you can start. There's very much a stage of reevaluation and of getting rid of the dead wood and really connecting back to you again. And I think you do need time. We have quite a lot of that at the moment. You often need stillness and you often need some time alone to really sit and think, well, who am I? What's been my journey so far?
Yeah.
Where am I going now? And I think putting and actually clawing back some time for ourselves as well, because many women just haven't done that. They've put themselves so far down the pecking order, and it's another layer of guilt. But then I think, well, it's a reset, and it's time to take stock, push ourselves a little bit higher up on the pedestal because we deserve it.
Yeah. Start
to look after ourselves, because if we don't, your body tells you much more. And it's even things, as I say, particularly with the protein. I think if you really tune in, so I will start to think, I'm flagging a bit in the afternoon, and I'm hoping my old trainee never watches this, because I used to resort to a couple of crumpets, which she would roll her eyes at. And now I'll have those little protein balls or a little bag of nuts, because I know that that's the right thing for my energy. So there's lots to learn about this. It's really interesting. And I think it's getting women to connect back with themselves again instead of running around after everyone else.
Yeah. One of the things that we call it in the community that I work with clients, I call it creating a base camp habit stack. And I think as I've seen, I've worked with a lot of women, as I've seen women come into this time in their life, it's about readjusting what was the habit stack to having a new habit stack that really readdresses these fluctuations in hormones, because there are really great practical things that we can do. And I always love the way that you talk about it, as you create the structure with the HRT. Yeah. It's almost like you create this solid scaffolding system in the mind and body. Yeah, that's how I see it. When you talk about it, I think of it as like creating this scaffolding system throughout the body. And then we create this, what we call base camp habit stacks, which is like And it sounds like it's not rocket science, but it's things that as women, especially if you're women in leadership roles, if you're women that are, you know, nurturing teams and communities and families, you just go so far down the pecking order.
Yeah.
So if we see, well, if you've got the scaffolding in there with your HRT, and then you get your hydration in there and your protein in there, maybe some additional supplementation, and all these good things like, you know, the yoga and all that stuff that helps balance everything out. The reality is you're going to be so much more, so much more empowered and have so much more energy to cope and function if you make sure that you pull that system together.
And you're going to be more productive as well, aren't you?
Yeah. Oh, way more productive. Yeah.
Yeah.
And I think that's important. That's one of the things that I know we've constantly worked on, is this base camp habit stack, where, you know, but as women move through, it's like, right, we need a bit of scaffolding around it now to help it hold up. And I think as well, Dr. Zoe, it's about, I know there was a lot more conversations. There was a piece in the Sunday Times by Meg Matthews talking about her relationship with moving through the menopause. And I think it's becoming so much more acceptable to speak about it, whereas years and years ago, I don't remember my grandparents, my grandmothers, my mother, I never even heard it mentioned.
No, and this was, I think, because I was talking to a friend of mine, and her mum had said, well, I didn't have any symptoms. And she said, you did, Mum. Don't you remember how depressed you were?
Yeah.
And she said that was menopause.
Yeah.
And it wasn't the typical hot flushes. She didn't know what had caused it. You weren't allowed to speak about it, but she said you were quite suicidal. That was your menopause. And I think this is the thing. This is why we keep shouting about it, because it's not a whim. It can be really, really awful. And there is, for the vast majority of women, the HRT is a very safe treatment. And then for the women that can't have it, again, we need the discussion, because there are ways of navigating it with nutrition and all of these peripheral services. It needs to be acknowledged and talked about first and allowed.
Yeah. And that's one of the reasons why we're like, we're going to use this time now to talk about this.
Yes.
What is the one final thing as we wrap up, Dr. Zoe? What is one action that you would recommend that women take this week if they are symptomatic? What is one thing that you would highly recommend that they do?
I always, so when I saw people as a GP, I would just say, go and read about this. If there are any fears about HRT, there is a brilliant book called Estrogen Matters.
Yeah.
And I think that just explains exactly how all the studies were done and just goes through the hormones. And I think as a starting point, that's brilliant. The Menopause Doctor website, the podcasts on there, just get informed.
Phenomenal.
Really get informed. And I think it means that you then, it's your decision. It's not your neighbour's decision. It's not your mum's decision. It's not anyone else's decision. It's your decision as to how you're going to manage this.
Yeah. And I think there is so much, I mean, the Newsom Wellness Clinic website is full of so much information. And literally I've sent women in that direction. You know, I've had clients come be treated at your clinic and they've come out like, there's a whole new world out here.
Yeah.
So literally that it's almost like the doors open back again on life. That was what one of my clients said after having been treated by you guys. She felt like the doors were back open again, and it was like, oh, this doesn't have to be the way it is or the way I thought it has to be. And that is what can happen as a result of us dealing with this rather than hiding it away.
I think it's the whole thing of I mean, many women think they're going mad, and it's just the fact of being listened to. And in the vast majority of them, they're completely right. It is their hormones.
Yeah. So to wrap up, go to the Newsom Health website, go and do lots of reading, download the podcast, follow Dr. Zoe on Instagram at Manchester Menopause Hive. She is funny and informative. And you, if you're based in Manchester or anywhere else in the UK, you can now have a Zoom consultation with Dr. Zoe. She's there waiting for you. Thank you so much for joining us today, Dr. Zoe, and helping, because I know that women have been like, oh, what happens now? I can't, am I stuck now in this place because we're not allowed to go anywhere or do anything?
No, we need to, we need to wind that back. There are lots of things that are still happening despite of COVID.
Yeah, so thank you so much for joining us today. We really, really appreciate it. And Dr. Zoe is actually going to be on season 2 of the podcast, where she is even more illuminating and drops so many more knowledge bombs than she has in the little snippet that we've done today. So we'll look out for that. We will link it in the below once we've got it published. Thank you. See you later.
All right, take care. Bye-bye.